Can functional neurology really help my vestibular issues? Well, the vestibular system is complex. It's an integrated system that lets you know where your head is in space in relationship to gravity. So with trauma and injuries and concussion, you could have issues ranging from having BPPV, so crystals loose in your inner ear that are making you dizzy as you're tilting your head through different positions. We have all the best technologies to diagnose that, figure out which canal it is, whether it's anterior, posterior, or horizontal canal, and we can do all those reposition maneuvers to help get those crystals back in the right place. Hi, I'm Dr. Jeremy Schmoe, founder of the Functional Neurology Center in Minnetonka, Minnesota. We work with patients with unresolved post-concussion symptoms and other complex neurological issues. Our approach to complicated neurological issues is very different from other clinics. We use the latest technologies and a combination of functional neurology, functional medicine, and chiropractic care to get to the root cause of what is causing your problems. With this approach, we're able to get you back to optimum function and get you doing the things that you love to do. Can functional neurology really help my vestibular issues? Number two, you could have issues where the force that basically went into your brain caused torsion in through the brainstem, and that could lead to a central vestibular issue. We utilize VNG, ReadyTrack technology. We literally do a laser-guided scan where it shoots a laser through your pupil into the back of your eye, and we can scan your retina. So if you've seen other providers where you've done VNG, that you've done other testing, and they say that you're normal, but you're still having symptoms, we have better technologies that can get to the root cause. So we shoot the laser through, we look at the back of the eye. Your front of the eye might not look like it's moving that much, but when we scan the back of the eye, we could see that you're torsioning or you're drifting to literally 0.1 degrees of movement. And we are the only clinic in Minnesota that actually has this technology. So utilizing ReadyTrack and VHIT that graphs out all the connections between your head and your neck and your eyes, we're able to integrate and figure out, is it the neck, is it the eyes, is it the vestibular system, or is it the integration of those systems, and then get to the root cause and develop a very specific plan to help get you better. There is hope. There are answers. Click the link you see with this video to schedule a consultation with my office today.